I'm an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf, and this episode is everything you need to know about premature ovarian insufficiency, midlife health, and how to advocate for yourself. Before we get into it, a few things I want to make very clear. One, this is not meant to be any type of medical advice. So if you have any questions about your health, make sure that you go see your healthcare provider. And if you have any questions about your religion, make sure you go talk to your friendly neighborhood religious leader. This is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So today I'm super excited to have on with me Dr. Esra Shermadou. Dr. Shermadou, if you could please introduce yourself to the listeners and viewers out there.
Yes, definitely. Thank you so much for having me. I'm excited to be here. So I'm Dr. Esra Shermadou. I'm a board-certified family medicine physician with a focus on hormone health, weight management, lifestyle medicine. And really, my personal health journey kind of helped influence and shape where I am professionally today. After I was diagnosed with cancer in college, I developed a lot of hormonal issues because of the chemotherapy that I had to undergo. And I never really felt like the impact and effect of the hormonal issues was ever really discussed with me. And that kind of led me onto my own personal journey of learning about hormones and their impact on our long term health and even just our daily life, quality of life. And especially during this, perimenopausal and postmenopausal period, it's had significant impact on us. It also led me to learn the importance of movement and strength training, and that was a big part of my healing process and something that I love to help others incorporate into their daily life as well. So,
Sounds great. Awesome. So actually, I really want to get into a topic that I actually have not covered on the Muslim Sex Podcast, and that is premature ovarian insufficiency. So you have a personal, lived experience that I'm so happy that you are willing to be vulnerable enough to let us in on and share with us. So tell us a little bit about what is premature ovarian insufficiency.
yeah, so premature ovarian insufficiency is a condition where, number one, it can be caused by a lot of different things. So most of the time, we don't necessarily know what causes it. It can be caused by surgery, chemotherapy, other medications, but essentially, it's when you lose your ovarian function before the age of 40. So I was diagnosed with lymphoma at the age of 21. It just kind of honestly, I just woke up with it one day. I did not experience the night sweats and weight loss that other people sometimes experience with it. I just woke up with some swelling in my neck one day, and went to the urgent care, sent to the hospital, and it just kind of started from there. And so you know, when you go through that experience, and especially when it was so sudden onset, it was just kind of like appointment after appointment after appointment. There was a small discussion about, being 21, the risks of chemotherapy on my ovarian function and what that could possibly do. Kind of briefly talked about different options, but at that time, I was 21, a lot going on, and my parents being immigrants, you know my dad speaks English very well, my mom understands the basics, but both of them definitely not medical English. And so it was just the idea or thought of, do we want to try to you know or undergo anything significant to try to spare or save some eggs. That really wasn't a big part of the conversation. And it seems like everything was just kind of moving so fast at the time that, essentially I was started on birth control pills to see if that would kind of help suppress things a little bit. And essentially, I just kind of started on birth control pills before treatment, stayed on them for my time period during chemotherapy, which was just over a year. And I also had to undergo a stem cell transplant at the end. So I did have to go through a higher period of high dose chemotherapy as well, which really affected things. And so, essentially, thankfully, was able um, I was able to, get through treatment and survive the cancer, and everything was going well. And then, kind of like maybe 6 months to a year after treatment, I was still having regular follow-ups with my oncologist, and I was just like, "Hey, am I supposed to be getting my periods back?" Because they haven't come back yet. And so she sent me to a reproductive endocrinologist at that time, who, did some blood work, including, my AMH level, which remained low, and we he tried me on a couple supplements to see if that might help boost it, and it did not. So essentially, I was just kind of told, hey, you need to be on these birth control pills until kind of like menopause. And I didn't really understand why. It was never discussed with me, like the impact and role that estrogen has on our health. So like on bone health, heart health, cognitive effects. That was never discussed with me. It was just like, hey, you need to be on these, and so that's it. And so at that same time, I was also getting ready to start med school and residency, and you know what that's like. You don't have time to go to the doctor or anything like that. So, you move around a lot, and so I at times stopped taking my birth control pills, for a few years, and I felt fine, thankfully, without it. I didn't really notice a difference. And so, plus, I went to, in med school, we learned about the WHI study and how bad that is. And I was like, well, I don't want to be on these like pills if, this is, if hormones are bad. And so that kind of also just didn't really motivate me to seek care. But every so often, I would find myself like learning about premature ovarian insufficiency, and what the treatment for that is, and all of that. And so I would always have these periods where I just kind of delve into it and try to learn more. And so then I'd get back on my birth control pills. I'd see an OB-GYN or something, and I was just told like, yeah, you need to be on birth control pills. And that was kind of it. I never really was told why. And it wasn't actually until a few years ago when I came across another course, and um, learned even more about premature ovarian insufficiency. And this time I really understood the impact that it has, in not having, the hormones on board to help protect, bone health and heart health and cognition, all of these things that I realized like, wow, I should probably be on some hormones. And so, and then from there, I just kind of learned about just perimenopause and menopause in general, and how women really need to be supported during this time period. And, it's, the night sweats, and, the other symptoms that you can experience that affect your quality of life is huge. That's a big thing. But even more so is the long-term health complications. The heart health. That's huge. It's the number one killer, and then the osteoporosis, hip fractures, all of these things that can have significant impact on our mortality and just living life. And so that's really inspired me to kind of pursue this further. And
Yeah. I I think that, like a few things that you, I think, just kinda glossed over, which are huge, and I think that, I like, I would be if I went through that, I think I would be very, very upset with my doctor about not telling me about, let's say, like, freezing my eggs or doing something like that, right? Like, they basically you had a castration event, right? Where you were placed on chemo. Obviously, it was no fault of your own. And you went through all of this without the proper knowledge and education, without them even telling you what was happening. And then you're supposed to just figure it out on your own. I mean, that to me is really unacceptable.
yeah.
Really, they should have sat down with you. I mean, you were so young at that time, right? You're at the age
Mhm.
21, you have this horrible diagnosis of lymphoma. They tell you they're going to give you chemo, but they don't give you options. They don't have this discussion about like freezing eggs. I get it that, a lot of us, my parents are immigrants, and I don't think they would have understood that at that age
Yeah.
either, right? I know I would not have that knowledge. I wouldn't know what to do about this.
Mhm.
And so you think that perhaps, somebody should have really sat down with you and said, "Hey, listen, this is what this means. I'm not sure if you understand, but this is what this means, right? If
Mhm.
you want to have children later on in life, this is what we should consider." And I really feel like that was kind of a failure of the medical system at that time for you, because they never had that discussion with you, right? And then not to even tell you the importance of hormones, like that's just awful, right?
Yeah.
First they castrate you, then they don't tell you about what's going to happen. Then they don't offer you, or tell you you need to be on birth control, but they don't explain why, right? Like,
Mhm.
why is that? Why do I need this estrogen and progesterone? And why didn't they give you like, the bioidentical ones? Why didn't they give you estradiol and progesterone? Why did they give you the synthetic ones? Because that was probably easier for them, right? And they
Mhm.
really even think about what was happening, and they probably felt like, that because we know that the birth control have a higher dose, so they're like, well, she's really young, she needs a higher dose.
Mhm.
Fine, I get that, but like, at least tell you the ramifications of this chemo and what it's going to do for your future fertility, and tell you like all the things, right? Like about the vaginal dryness and the decreased lubrication, and tell you about the bones, and tell you about the heart, tell you about the brain, tell you about all of that, right? And for you to have gone through all of that at this young age and then not even be told about all these things that happen later on really is just it's like almost medical malpractice. I mean, like, how could they do that? How could they not even tell somebody that young and tell them what's gonna happen? I mean, I don't know. You're I'm really upset for you. Like, I'm, like, really listening to you
Yeah. Yeah,
thinking.
I mean, there was, like, a brief discussion about freezing eggs along with everything else, and I don't know if it was like, I feel like freezing eggs is a bigger topic or has been in the past few years, or maybe it's just because of my age and I'm just become more aware of it, but I feel like it was very briefly discussed, but again, it's just kind of the same thing where that's a big topic. It was, just kind of at, like, one appointment and, with, like, my parents and stuff, it was a lot. Like, I don't know if they how much they understood, what an impact it was, and, I don't know, but, yeah, it was definitely yeah, it was, everything was moving so fast, and it was, yeah, definitely not a long discussion or anything like that. It was just like, kind of glossed over, I guess, is what I felt like it was.
Yeah, and the thing is that listen, when you're this young and you don't understand the ramifications of what's going
Mhm.
on, I'm sure you were probably overwhelmed with, first of
Oh,
all,
yes.
the diagnosis, right? At the age of 21, like who's even thinking that they're going to get cancer, right? So
Yeah.
then you get this diagnosis, you're overwhelmed, you're probably upset, and you're trying to process this whole thing. And then they tell you about the medications and blah, 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 and all this stuff. But the thing is that there should have been some, like, follow-up care, right? There should have
Mhm.
been, like, some discussion about, "Hey, listen, now that you've gone through all of this castration event, now what, right? What do we
Mhm.
do? How do we preserve your bone health? How do we preserve
Yeah.
your heart health? How do we preserve this cognition, right? Your brain health? What do we need to do? Here are the options, this is what you need to do."
Yeah.
I think, like, that kind of follow-up would have been very important for somebody as young as you going through everything that you went through, right?
Yes.
Because you wouldn't have stopped your birth control
Oh,
pills, because you didn't feel like taking them, or you just
right.
because I mean, you stopped it because you didn't understand the significance of
No,
it, right?
exactly. Exactly.
And then I think it's important, you mentioned something to me offline where you said that you were diagnosed with osteoporosis, right?
Osteopenia. Yeah, I had it in
Osteopenia.
my, lumbar spine, and I believe in, my maybe it was just my lumbar spine, and so, and I just kind of I honestly I don't know that I attributed it to estrogen at all. I don't even know, but I just knew that strength training would be good for it, and so that's kind of what, I learned to, like, kind of, like, when I going through chemotherapy, it's you're like the days after my treatments, I was just kind of like bedridden and I would just like want to get up and move, but it's like you don't have the energy. And so I was just like, okay, like after I am through this experience, like, I'm going to start like running. And so that kind of like pushed me to start running afterwards. And then I got into strength training. And so I think really through the strength training, that's, I was able to reverse it from that. And so that's why I'm also passionate about that because it really does make a difference. And so, but yeah, I don't know that I attributed it to the loss of estrogen because I think I would have then started back on my birth control pills sooner and stayed on them. So
Yeah, I
it
mean,
was.
yeah, I think that, like, had you been given the proper knowledge, the proper guidance,
Mhm.
I think that you would have made obviously more informed decisions about your body and your own health, right? I think you
Mhm.
would have figured out that if I don't take these hormones, it's going to start affecting me and lead me to have like chronic diseases like osteoporosis and heart
Mhm.
disease and what's going to happen to my brain health, right? Am I going to
Mhm.
start to develop dementia? And there's some
Yeah.
correlation with Alzheimer's and
Mhm.
all of this stuff, right? I mean, it's not something that's benign and somebody so young,
Yeah.
right, should absolutely have that proper information and that knowledge. So I don't
Absolutely.
know. I think that, you're dealing with it more graciously than and I think I would have been very, very upset. So, tell me a little bit. So when did you start experiencing, like, perimenopause? Or did you?
Um,
Did you go straight into menopause? I mean, did you have the hot flashes and the night sweats and all that?
Honestly, I didn't. Thankfully, I didn't. And so, um, I don't know if, and to be honest, I don't think my mom did like experience those either. So maybe there's like a genetic component to that I didn't. So thankfully, I didn't really experience those. Now, like sleep, definitely,
Mm,
that's something that I really suffer from. And so that's probably I would say maybe that's my biggest kind of thing that I feel like that it's affected me is a sleep issue, but I didn't ever really experience like the hot flashes or anything like that. And so yeah.
mm. Yeah, so, so tell me a little bit about, like, your journey now. So I know that you are, so you came across a course that you saw that you learned more about, your heart health and what happens in menopause and things like
Mhm.
that. So then it kind of sparked your interest, and I guess perhaps it changed the trajectory of your medical career now, right? Like you're thinking you
Yes.
want to do something else. For the audience and listeners out there, so you are currently a family practice doc, is that right?
Mhm. Correct, yes, and, I you know, I've done different things in the realm of family medicine. I did some ER and I did some urgent care afterwards, and, while I like doing what I did, there was always a point where I just never really felt that passion for it until I came across this course, and that just kind of like lit me up, and it brought me so much excitement learning about it, and just kind of telling people about, talking to women about the importance of, hormones and stuff. So even like, when I see females in the urgent care, somebody coming back for with recurrent UTIs, that's always something that I talk about is, hormones, hormones, hormones. And so for that reason, yes, I decided to open my own practice. And so I'm very excited about that. I've been working on it for some time. And hopefully, I'll start kind of in the fall of this year. So I'm very excited about that, very passionate about that. I'm going to be focusing on hormone health and just kind of the metabolic changes as well that we can often see
Yeah.
associated with it, lifestyle things that we can do, but also, of course, hormone therapy too. Again, not just because of the hot flashes and things, the quality of life things, which are significant, are very significant, but also for the long term health. I think knowledge is just so important. Whether or not a woman decides she wants to be on hormone therapy is totally up to her. All we can do is teach. And having the knowledge to make those decisions for yourself is crucial because we can't just rely on other people to make the decision for us like they have been, for decades now.
Mhm.
So I think um, teaching females about their options is really brings me a lot of passion. So
Yeah,
very
I think that I think that to your point, what you say about, like, giving women, um, the autonomy, right, to decide whether or not they want to go on hormones. I think that for so long, that decision was made for women because of the WHI study and because of the fear of hormones and for so many physicians. And
Yeah.
I'll say that, I was one of those physicians, right? I did my residency in 2002.
Mm.
Sorry, in 2000, and I was a resident in 2002 when that WHI study came out. And, all of my attendings were like, hormones are bad and we don't prescribe hormones and this and that. And so, for so many years, when women would come to me and ask me about hormones, I had no idea. First of all, I didn't have that knowledge
Yeah.
about perimenopause, menopause,
Mm-mm.
know anything about hormones. All I remember was that, hormones are bad and if women really, really need them and they have to like really beg you for them,
Yeah.
then you give the smallest dose for the shortest amount of time. I mean,
Mhm.
that's ridiculous, right? We know that's not true.
Yes. Yeah.
But, that's what we were taught. And I remember even just, I don't know, was it a year or 2 years ago, I was doing a podcast with somebody and, I said that and he was like, "Oh my God, where do they come up with this nonsense? That's not true. That's not, that's not the, whatever." So anyways, I think that what's really important is that we provide the accurate knowledge, right? The
Yes.
accurate education to women, tell them about perimenopause, tell them about menopause, give them the option,
Mhm.
assuming that they are a candidate for
Yes.
hormones, and then let them decide, right? Don't make the decision for them. And I don't think that, another myth that I see often is that women think they have to be menopausal to
Mhm.
start, hormones, right? And that
Yes.
they're not that they can't start in perimenopause. And that's not true. We know that's not true, right?
Absolutely, yes.
We
Especially when they get blood work done and their blood work is quote unquote normal, and it's like, well, you're in perimenopause, so you might on that day they may have been normal, but we treat based on symptoms, not based on lab values. But that's absolutely, a big thing that, a big myth, I guess I would say, is that needs to be debunked is, even if you're still having periods, if you're having symptoms consistent with perimenopause, absolutely appropriate to start on therapy, as long as you're a candidate. So very, very true.
What do you think you would have liked as a young woman going through premature ovarian insufficiency, right? What
Mhm.
type of discussion do you think you would have liked to have with your knowing what you know now,
Yes.
right? So
Mhm.
what type of discussion do you think would have been most helpful to you as a young 21-year-old at the time that you were diagnosed with
Mhm.
lymphoma?
Yeah. I think, just a bigger and more of a sit down conversation about the different options and the ramifications, especially with my parents being immigrants, and, English really as their second language, maybe bringing in translators and just kind of discussing this a little bit further. Whether or not I would have gone through it at the time, who knows? But I think just having a bigger discussion around that is the first thing, and then the second thing I think more importantly is just a discussion even afterwards, like just knowing the importance of hormone therapy because I went through years and years of just not being on any medication and anything like that, and had I known what the impact was, I definitely would have taken my birth control pills for sure. So I think just, more education and discussion about the ramifications of the lack of hormones, that would have it on my effect, not just fertility, but long-term health, long-term health in general. So
Yeah, yeah. I think that's so important, and I think that, that's unfortunate that, they didn't have that discussion with you, but, so let's say that somebody is having premature ovarian insufficiency now, right? That so they've been, through menopause, right? And they're less than the age of 40. I know that currently the Menopause Society, when you look at the guidelines for premature ovarian insufficiency, they
mhm.
say that women should be on hormones at least up until the normal age of menopause, which is,
Mhm.
age 51 and 52. So that for you is, was at that time like 30 years at least, right?
Yeah.
Um, and for women to stay on hormones at least until that time, and then obviously if they want to continue, then they continue, but, that it's just so important for women at that age to, be on these hormones for exactly what you said, for all of the benefits that it has on the brain, the heart, really everything, right? Because we know we have estrogen receptors all throughout our whole body,
Yes.
and when we don't have estrogen, so many things happen, right? Like we get weight gain, we get
Mhm.
pre-diabetes, right? We get that metabolic syndrome that starts to happen. We get, hair loss. We get, our collagen is affected. So
Yeah.
many things, right? Our brain health. Did you experience any of those symptoms, like the cardiometabolic syndrome of like menopause?
Not that I'm aware of. But at that time also is when I became very, very active, strength training, cardio, eating healthy. So all of that kind of happened at the same time, thankfully. I think otherwise I definitely would have seen it. Now, I did definitely notice that time period where, weight loss was difficult. I did have some weight gain as well.
Mhm.
So I did notice that. But metabolically, like looking at my, lipid panel and my blood pressure and all of that, those levels were always, remained healthy. And I think that I attribute that to just being active and, eating healthily. So,
Yeah, absolutely. So, I'm wondering, just in terms of like your mental health, how did that fare, during this whole time? I mean, so we know that women in perimenopause and in menopause, they often will develop new onset anxiety and depression. A third of women will. And we also
mhm,
know that women, during this time in midlife tend to get prescribed antidepressants the most, right?
yeah.
So, did you, have any of these mental health issues with anxiety or depression or any of those things as you went through this premature ovarian insufficiency?
I wouldn't say anything significant. I think anxiety is something that has always, um, you know, I feel like I don't think that it's anything, and it wasn't anything that needed treatment. I think it was always something I was able to deal with. Again, I think that my lifestyle has been able to help that a lot too, because, exercise, strength training, all that, that's a huge, huge, huge mental release for me. And so, if I can't get that in, especially like, with residency and stuff like that, I feel it. I feel it. So I think my lifestyle really played a large role for me. And also just kind of, religion. That's a big thing for me as well. And so, I think all of that really helped to manage that a little bit better for me.
Yeah. I mean, you mentioned that you do weight training, and,
Mhm.
I don't think people really understand when, like I do weight training, but it's nothing like the weight training that we do. And I've seen you lift in the gym. So tell people, like what pound, what size, what weights you're using when you lift weights.
Yeah, I do a lot of powerlifting. I'm getting into some Olympic lifting here too. And so I can deadlift quite a bit. Let's see. Definitely more than double my body weight. Um,
Yeah.
Bench press, like, at least my body weight. Squatting also, let's see, probably maybe 1 and a half ish my body weight, something. So I can lift. I can lift. I may not look like it, but I can. So,
That's amazing, that's amazing,
yeah.
and then right, because, I mean, that's actually what you need to, so I myself have osteopenia, and,
Okay.
I need to lift much heavier, than I do, and, I think I need to, come by and get some personal training sessions from you.
Absolutely. I would love it.
Because
I would love it.
because, I definitely need to get stronger, and we
Yeah,
all know that, I mean, really, the muscle is the key to longevity, right? We know that
absolutely.
we need muscle to protect our bones so that we don't become
Mhm.
frail and end up in the nursing homes with like a fractured pelvis or,
Yeah.
fractured hip, and then
Mhm.
with recurrent UTIs, and then you die of sepsis, right? I mean, like that
Absolutely.
that is
Absolutely.
something that can absolutely happen. So it's so, so important.
Mhm.
I'd love to know, as you've gotten further into kind of like your own journey with your own health and also with menopause, what changes have you seen since you became more diligent with the hormones, right? With the estrogen, with the progesterone, what have you seen in terms of when you didn't take hormones religiously to now?
Mhm. Yeah, so, that's kind of all been in the last, year, I will say, so it hasn't been terribly long considering, when I was diagnosed, but I do feel that I can be a little bit stronger, like, my energy's a little bit, higher compared to normal as well too, or what was my my normal without being on medication, and so I do notice that, it does help with that, the fatigue is better, and a little bit of the cognition as well too. And so,
Mm.
one thing with premature ovarian insufficiency, I think that's also important to remember is that a lot of times, if you are being treated for it, sometimes you can be treated just like any other menopausal woman. But it's important to know that you cannot be treated just like any other menopausal woman. You need to be on higher doses of estrogen and also testosterone too, because, you know, women, especially during reproductive years, make, more testosterone than estrogen. And so when you lose that ovarian function, that's a lot of times where our testosterone can come from. And so you need to be on testosterone replacement as well too. And so that's one that can often go forgotten. And for me, definitely was the case. It was never ever brought up until recently. So um, definitely make sure if you're in this situation that you're getting all 3 replaced too. So
Yeah, absolutely. So that's exactly what I was going to say, that, many women feel dismissed during this time. And especially for somebody that, has premature ovarian
mhm.
insufficiency, I'm sure, or misdiagnosed during this time. How can they advocate for themselves when they feel like maybe they're not being heard?
Yeah, so definitely important to do your own research, because I did feel like a lot of when I did seek care, I felt like it wasn't, and I would be told like, "Hey, I'm not too familiar with this. Maybe we need to send you to another specialist." And so it's not something that a lot of doctors treat regularly. And so you need to do your own research and kind of come prepared with what, like, hey, this is what I looked up and this is what I was told I need to be on. And so, and if you don't feel like you're getting the proper care from a certain provider, unfortunately, it can take a little bit of time to find somebody else, but just keep advocating for yourself. And hopefully, with this recent push with discussing hormone therapy and all this, hopefully, we can get more providers who are more informed, more educated, or more comfortable prescribing hormone therapy. And so, hopefully, it's not going to be a long journey for you when the time comes or if the time comes. So
Yeah.
definitely advocating for yourself for sure.
Yeah. So, what do you think is like one myth about women's health in midlife that drives you absolutely crazy?
Yes. So, one myth I would say is kind of what we brushed on earlier was that, if you're still having your periods, you can't be on hormone therapy. And maybe even more so than that is the lab values, just focusing so much on labs, like, your labs are all normal. They're normal. Like, I don't know what you're having, why your symptoms don't have anything to do with your labs. And so I think that's a big myth. We cannot rely on lab work to determine whether or not we're in perimenopause. That is a clinical diagnosis. We base it just on your symptoms. So, if you're seeing a provider, you're having all these symptoms and they get labs and they tell you your labs are normal, nothing to do about it. That's not the right answer. Go find somebody else.
Yeah, absolutely, absolutely. So what is one supplement that you've noted that you've used perhaps as you've been through, since you've gone through menopause,
Mhm.
that you absolutely believe in?
Creatine. That's
Yeah,
something I've been taking for years, and it's a very old supplement. It's been very well studied, probably one of the most well studied supplements that we have. We know that when combined with strength training, really increases lean body mass, which we definitely need. And even more so, more recently, there's been a lot of research about it with possible positive effects on cognition, memory, mood, sleep. So there's a lot that's coming out on it even more, but definitely one that I would recommend.
Hmm. Well, I have to start being more diligent about that. Not
Absolutely.
taking yeah, no, I definitely could use more muscle mass for sure. What about one habit you wish more women adopted in their 40s? What would that be?
Strength training for sure.
I
I
know.
think during this time period, we are very busy. Perhaps you have kids, have work, and maybe you're trying to seek a promotion. Lots of life stuff going on, and in general, you're probably feeling fine in your 40s, and so it's not something that's on the top of people's minds, and they're just like they're just surviving life at that time. But I think if we can just start at least like twice a week, getting some strength training in, you will see those ramifications and those benefits, well down, several years down the line. And you're going to be so thankful that you started it when you did. Now, you can start strength training at any age, it can be modified. So never fear that you're too late. Because there is no such thing as too late. Your body will always benefit in some way, shape, or form. So definitely start whenever you can. And just keep on with it. And I think that's one thing that it can be overwhelming, especially if you're not very active, or let's say maybe you just do a little bit of walking. Incorporating strength training or doing something different exercise wise can be overwhelming. You can look online and this person's doing this and that person's doing that, and you don't know where to start. And so if you can invest in a coach or a trainer, that's going to be huge. um, and you don't have to do it for a long time. Even just kind of learning the basics, and that will take you so far, well beyond your years. And you can teach others too. And so that's definitely something that I think more people shouldn't like overlook. If
Yeah.
if you need a if you need help getting started, definitely seek out a trainer.
Yeah, absolutely. So, what do you think is one of the most under discussed symptom of menopause?
I That's a good question. I think one of the most under discussed symptoms would probably be the emotional changes. So the anxiety, the depression. I don't think that's something that many people attribute to perimenopausal period or postmenopause. Really the hormone fluctuations, and as we discussed, hormone receptors are located all over our body. They affect every organ in our body, and including our neurotransmitters like dopamine, serotonin, GABA. And so whenever we're having those changes to our hormones, that's going to affect those neurotransmitters as well. And those affect our anxiety, our depression, just emotional regulation. And so often women during this time period will say like, hey, my anxiety is off the roof. I've never had panic attacks before in my life, and now I'm having them.
Oh, yeah.
My mood is all over the place, and so they don't necessarily attribute it to hormones. And sometimes just starting on estrogen or progesterone can have all the difference in the world. Sometimes it takes more than that. Sometimes we do have to add specific antidepressants or incorporating lifestyle changes too, that can make a big difference too. But I think that's one area of symptoms that isn't necessarily attributed to this time period.
Yeah, I mean, I think I wish I would have known about, like, these panic attacks,
Yeah.
and these heart palpitations and all
Mhm.
this stuff
Yeah.
that I had no idea about, when I was in the earlier stages of my perimenopause. I
Yeah.
mean, I think that I just thought I was going nuts, like, I was like, "Okay, I
Yeah.
know that."
You and everybody else.
Yeah, yeah, for sure, for sure. So what advice would you give your younger self about aging?
Yeah. So, aging, I think we need to start looking at it as a more positive thing,
Yeah.
embracing it more, and just kind of taking it as is. It's, as we age, we become more confident in ourselves. We care less about pleasing others, especially if we don't know them. And so I think just embracing it, taking it day by day, and making the most of it. I always say age is but a number. So,
Yeah, yeah, and I just think that it's, for, those of us that are able to get older, it's such a privilege, right? We know
absolutely.
there are so many people throughout the world and
Yeah.
currently right now
Hmm.
that, are not able to age, right?
Yeah.
That are
Absolutely.
going through war and things like that, that are not able to age. So I
Absolutely.
think that it is an absolute privilege to be able to get older. And lastly, tell me about say, like a mantra or a mindset that you share with your patients about midlife.
Yes. So somewhat relates a little bit to what we just talked about, but I think one thing that we need to start doing is thinking about midlife as a more positive transition.
Yeah.
Um, I think there's a lot of negativity related to menopause, and you just kind of hear people saying, like, oh, these hot flashes, menopause, oh my gosh, and um, research does show that if we start thinking about menopause or just anything in general more positively, we don't have some of those negative effects with it. So, like in the Japanese culture, I believe menopause is seen as a positive transition. And not surprisingly, Japanese females don't experience as much or don't report as many negative side effects associated with menopause because they see it as this positive transition. So I think we need to take a look at how we are framing things and just kind of reframe them to be more positive, because that really can make a huge difference in how we, live that time period.
Absolutely. I mean, mindset is huge. And
Mm,
according to the SWAN study, we know that Asian women actually go through menopause or perimenopausal symptoms for the least amount of time, for 5 years, right? So,
yeah,
that African Americans tend to go through it for 10 years, Hispanic women 8.9 years, Caucasian women for 7 years, and Asian women for 5 years. So perhaps, that has a lot to do with it,
yeah,
is
that
how they
mindset.
see that transition, right? Into from midlife into like menopause and into those postmenopausal years. Um,
Absolutely.
Obviously we're saying, and actually, the Menopause Society actually says cognitive behavioral therapy is one of the ways to alleviate hot
Yeah.
flashes and night sweats. I mean, I think that, I would say that yes, it is a modality, but it isn't the only modality. And I would absolutely use hormones
Mhm.
to with the hot flashes and night sweats. But
Absolutely.
definitely, it's a mindset, right? And if we can
Mhm.
change our thoughts, then we can change our feelings, then we can change our actions. And I think that that is probably one of the most powerful things.
Absolutely, absolutely, I agree 100%.
Well, thank you for being on. It has been super awesome to talk to you and to talk to
Likewise.
somebody with lived experience with premature ovarian insufficiency. I think that it's something that is a very, very important topic to know about and to discuss, and for our listeners to know about as well, because it does happen. And, but, I love the fact that you are thriving in your menopausal years, and you're showing us and guiding us how to do that. So I really appreciate your time. So for those people that are listening and viewing this and thinking, wow, Dr. Shermadou is totally awesome, and I'd love to know more about her, how can they find out more about you?
Yeah, so I am on TikTok, Instagram, Facebook, and YouTube. So just all under Dr. Esra Shermadou. So you can look me up on that. And soon to be, we'll be having a practice here in Dayton, Ohio. And so that will be posted on my social medias here very soon as well. So very excited. Thank you so much for having me.
Yes, awesome, and best of luck to you. I'm sure you're gonna do fantastic, and, lots of patients will be better served becoming your patients, so that will be amazing,
Thank
and,
you.
well, thank you for coming on, and, well, it's been real and really intimate, and, of course, it's not meant to be any type of medical advice. If you have any questions about your health, about ovarian function, about premature ovarian insufficiency, make sure you go speak with your friendly healthcare provider. And until next time, this is the Muslim Sex Podcast. So, thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So, be sure that you share it with all your friends. And thanks for listening.